So we are most appreciative that Dr. Pringsheim is presenting this evening. Dr. Pringsheim is Program Lead of Tourette and Pediatric Movement Disorders, Deputy Director of Clinical Research at the Matheson Center for Mental Health Research and Education, President of the Tourette OCD Alberta Network, and is an evidence-based medicine methodologist of the American Academy of Neurology. Thank you, Dr. Pringsheim.
Thanks, Julianne, and thanks to everybody who's come tonight. I'm very happy to talk to you about physical activity diet and supplements for people with Tourette syndrome or persistent tic disorders. So my objectives for this evening are to review published data on supplements, dietary triggers, and special diets in people with tics, to review published data on the effect of exercise on tics, and to discuss the results of a study performed at our clinic on the relationship between physical activity and tics. So why am I giving this talk? So, I've been running the Tourette syndrome clinic at the Children's Hospital since 2008. And I've spoken to thousands of parents of children with Tourette syndrome. I've spoken with thousands of adults with Tourette syndrome. And I find that the most common question that I get at the end of the visit is, what sort of things could I be doing at home to improve my tics? Are there certain foods I shouldn't eat? Are there certain foods I should eat? Are there supplements I should take? Are there any exercises I can do to make my tics better? So I know that this is an area of great interest to parents, but unfortunately, there's very little research in this area. So we did a survey of the literature to inform our own work in this area and undertook a study because I knew it was important to our patients. Before I go into the data, I just wanted to say a word about the Yale Global Tic Severity Scale. The Yale Global Tic Severity Scale is the most commonly used scale for measuring tic severity. We use the scale in our clinic to gauge how severe tics are. It's a clinician-rated instrument, and it measures the number of tics, the frequency of tics, the intensity of tics, how complex they are, how much interference with daily life activities tics cause, and also rate the overall life impairment caused by tics based on the patient's report, as well as observation during the clinic. And motor tics and vocal tics are scored separately. It looks at a period of 1 week. So it's typically we ask patients to report on these items for the week prior to attending the clinic. The total tic score is a total score of 50 points. So the maximum score would be 50 out of 50. And then the overall impairment score is 50 points. So I just wanted you to be familiar with this severity measure going through the presentation. So let's start by talking about dietary supplements. So I'll start with omega-3 fatty acids. So omega-3s are found in fish and seafood, nuts, seeds, and plant oils. And there was one randomized controlled trial, which lasted 20 weeks in 33 children aged 6 to 18 with Tourette syndrome. And these children were randomized to receive omega-3 fatty acid supplements at a dose of 500 to 1,000 milligrams a day, or placebo, which was an olive oil capsule. So just a quick word about randomized controlled trials. Randomized controlled trials are the highest level of evidence that we have when we look at interventions. In a randomized controlled trial, participants have an equal likelihood of receiving placebo or the treatment under study. And so in this study, which was a randomized trial of omega-3 fatty acids, there was no significant difference found between those who received omega-3 and those who received the placebo in their tic severity. So when they looked at the total tic severity on the Yale Global Tic Severity Scale, it was not different between groups. But Interestingly, the children who were randomized to omega-3 had lower tick-related impairment. So even though they had a similar level of ticks, the kids who received the omega-3 felt less impaired or disabled by their ticks. So there's another study looking at a supplement of taurine, and this is a class 3 randomized double-blind placebo-controlled study of oral taurine added to a medication called Tiopride in children with mild to severe tics. So you might be wondering, what's class 3 mean? So for randomized controlled trials, there's 4 possible classes: class 1, 2, 3, or 4. And class 1 is the best, and class 4 is the worst. Okay, so we rate something called risk of bias, and that's, you know, the likelihood that the trial reflects the truth. So this was a class 3 study of taurine. Now, Tiopride is an antipsychotic medication that actually isn't available in Canada. It's commonly used in Germany and in China. And so all the kids in this study received Tiopride, but then half of them also got taurine, and the other half of them got placebo. So they are randomized to either add the placebo or add the taurine to the Tiopride. So taurine is an amino acid that's available naturally in meat, fish, dairy products, and dietary supplements. It's thought that taurine acts on the GABA A receptors, and the GABA A receptors are involved in inhibition of brain activity. So it's thought that taurine enhances inhibitory neurotransmission, and that's a feature of other medications that work on tics. So they included children between the ages of 6 and 16. These children were randomly assigned, as I said, to oral taurine or placebo. And unfortunately, in the study, they didn't say what the dosage of taurine is. It's just not mentioned in the manuscript, so I can't tell you how much. And they were looking at the improvement in tics, which was defined as a 60% reduction in the Yale Global Tic Severity Scale global severity score compared with baseline. So the global severity score is the combination of the tic severity and tic-related impairment. So after 12 weeks of treatment, they found that 53% of kids who were treated with taurine had improvement in their tics, compared with 35% in the placebo group. And this was a statistically significant result. They said that the most common adverse effect experienced by participants was drowsiness, but there was no difference between the taurine group and the placebo group. So there's a class 4 prospective open label study of vitamin D supplementation in children with tics and vitamin D insufficiency. And they define this as having a vitamin D level between 10 and 30 nanograms per milliliter, or deficiency, which they define as less than 10 nanograms per milliliter. And they also, in addition to doing this trial, they looked at vitamin D levels in 120 children with tic disorders and compared them with 140 matched healthy controls. So what they found was that children with tics had significantly lower vitamin D levels than controls. So you can see that in both groups, the vitamin D levels are actually, the mean vitamin D levels are actually in the insufficient range. So in children with tics, it was 19 nanograms per milliliter versus 29 nanograms per milliliter in the control group. And that was a statistically significant difference. 93% of children with tics had insufficient or deficient vitamin D levels, compared to 56% of controls. So you can see that vitamin D deficiency or insufficiency is very common in the general population, especially in countries in the Northern Hemisphere. This study was done in China. They're in the Northern Hemisphere like we're in the Northern Hemisphere, and many people here are also deficient in vitamin D, whether they have ticks or not. But this study showed that the kids that had ticks were more likely to be vitamin D insufficient or deficient compared to the control. So 93% were in that category. So a number of those children participated in the trial where they gave vitamin D supplementation at a dose of 300 international units per kilogram per day, and with a maximum dose of 5,000 international units. And 36 children completed 3 months of supplementation. And after 3 months, the mean serum vitamin D levels rose from 21 to 51, and the mean Yale Global Tick Severity Scale total tick score fell from 23 to 13. So it's important to note that this isn't a placebo-controlled study. So this could be, the improvement seen could be due to just normal waxing and waning, but they were able to bring the vitamin D levels up through supplementation. So there's also an uncontrolled study just asking patients about their use of supplements and the results that they experienced, from taking supplements. So this was a questionnaire to people with ticks. The main supplements used by patients were vitamin B, vitamin C, vitamin E, calcium, and magnesium. And, all age groups, children, youth, and adults reported some improvement in both motor and vocal tics with the use of these supplements, and almost no one reported worsening of tics with supplements. So what's the bottom line? So as you can see, there's very little controlled data on the effect of supplements for tics. If I was going to use supplements for ticks for my child, I would try either the omega-3 or the vitamin D, just because we know a lot about both of these substances. For omega-3, the recommended dietary allowance has not been established, but it's generally felt, if you look in the literature, that doses between 500 and 1,000 milligrams per day are safe. There is an established recommended dietary allowance of vitamin D, which is 600 international units for people over the age of 1 year. So that's from the Canadian government has a recommended dietary allowance. The US government does. Many people actually take much more than this. So I can tell you that in multiple sclerosis, for example, people take up to 10,000 international units per day. So I would obviously be more conservative with that, especially in a child. So, 600 international units is felt to be safe. And I think that would be a safe thing to do for a child because vitamin D really has very few adverse effects. People who have kidney stones shouldn't take it, but otherwise, vitamin D is felt to be safe. And here in Calgary, we're inside for 6 months of the year. When we go outside in the summer, we're typically wearing sunscreen. So often, like the chances to absorb vitamin D through the sun are quite limited. So supplementation, I think, is quite reasonable. For taurine, the recommended dietary allowance is not established and the dose is not discussed in the research study. So I'm not so keen to recommend trying that, because I think that we don't really have any very strong evidence to support its use. So let's move on to dietary triggers. So there was a questionnaire study done by one of my colleagues in Germany, where they sent a questionnaire to people who attended a Tourette syndrome clinic, as well as a support organization in Germany for people with Tourette syndrome. And they asked participants to rate tic severity and indicate if they had ever felt an influence of 32 different foods and drink on their tics. And so you can see that Coke or Coca-Cola was the one drink that was most associated with worsening of tics, followed by coffee and black tea. And a number of people mentioned preserving agents and refined sugar as triggers for their tics. And there were no foods that were associated with improvement in tics. So that's, again, this isn't a trial. This is a questionnaire sent to patients to report what they've noticed for themselves and their triggers. There's another study looking to see if there's a connection between Tourette syndrome and excitatory substances. This is a Chinese study. They looked at a group of kids with Tourette syndrome and a group of kids that were controls, and they evaluated them for the presence of a number of different excitatory substances. They actually used a list based on what the U.S. Olympic Committee tests people for stimulants or excitatory substances. And they found that three of the kids with tic disorders tested positive for excitatory substances compared to 0 out of the control group. And the one that they found was ephedrine. And then this is just, again, a small case series on the effects of caffeine. So there's a case series of 2 boys looking at caffeine consumption and tics. And in both children, with removal of caffeine from the diet, their tics improved greatly, in fact, disappeared. There's only one study looking at a special diet. So there was a randomized double-blind placebo-controlled trial on the effect of tryptophan depletion on tics. They gave people this diet for 2 days and measured their tic severity, but there was no change in self-rated tic severity in response to tryptophan depletion. So what's the bottom line with respect to dietary triggers? So I found that caffeine is the most commonly reported substance to worsen tics. And that's, again, just from talking to thousands of people with tics and asking them, have you noticed any food triggers? And the most common one that people tell me is caffeine. So I tell people to avoid caffeine. And I'm sorry to say that to any coffee lovers in the group, but I think that I think it does worsen tics just based on the conversations I'm having with my patients. So I tell people to avoid it. I think it's all with dietary triggers. I think it's hard because I think everyone's very different in terms of how we react to different food and drink. And so I tell people to really just pay attention to your body. See if you're noticing any type of association between what you're eating and a tic exacerbation. And if you are able to see a pattern like, wow, every time I have a lot of dairy, my tics are really bad, then to try an elimination, eliminate dairy for a week and see if you notice any difference. I'm not for like very strict diets or, people doing things without some level of evaluation, right? You have to be careful. We don't want people to have nutritional deficiencies. So, we don't have really any science to back up specific diets. I guess the only other thing I would mention is that I have noticed among my patients who have celiac disease that when they go on the gluten-free diet, that their ticks are better. That's the patients that have celiac disease. I wouldn't recommend going on a gluten-free diet for your ticks if you don't have celiac disease. Okay.
Dr. Pringsheim, sorry, there's a direct question there from Janice in chat regarding what...
I'm sorry, I can't see the chat.
You can't see it. She just asked, what's an excitatory substance?
Oh, so an excitatory substance is anything that sort of stimulates the nervous system. So like caffeine, like ephedrine, like those are things that stimulate the nervous system. Yeah.
Great, thank you.
No problem, no problem. So, so just a word about dietary factors and the gut microbiome. So you've probably heard about the gut microbiome. It's kind of a hot topic in neurodevelopment and in neurological disorders. So Tourette syndrome is associated with immune responses, which are linked with inflammatory processes, and the microbial fermentation of dietary fiber may be important in the regulation and activation of inflammatory reactions in the gut. And this could be relevant for patients with Tourette syndrome. Again, like this research is really just at the beginning phases. We actually have a study going on at our clinic with my colleague, Dr. Martino, looking at the gut microbiome in children with Tourette syndrome. And if anybody's interested in participating, please contact Julian and let us know. So there could be a beneficial effect of omega-3 supplementations that could be mediated through the gut microbiome. And fatty acids are known to influence neurobehavioral development, anxiety, and social behaviors. So let's talk about aerobic exercise now. So the acute effect of exercise, so by that I mean the immediate effect of exercise, has been evaluated in an open label, non-randomized study. And they measured the mean tick rates in different phases of exercise. And they did the study by doing a kickboxing routine that was delivered through an Xbox. And they measured tick severity before doing the exercise, during the exercise, and after the exercise. And they found that during the exercise, tick severity lowered significantly. They also found that ticks increased after the exercise, but were still significantly lower than before exercise, than before the exercise took place. Okay, so it seems that there is an acute lowering of tick severities during exercise and immediately after exercise compared to before exercise. The chronic effect of exercise has also been evaluated in a 6-week study of 5 boys who received 2 30-minute sessions per week of moderate to vigorous intensity exercise. And all the participants experienced a decrease in tick severity compared to baseline on both clinician and parent rating scales. Again, this is an uncontrolled study. We don't know whether this is just time and waxing and waning, or whether exercise actually had an impact. So a number of studies have also looked at different physical activities and their influence on ticks. There's a cross-sectional study which looked at tick severity in 13 children using the Yale Global Tick Severity Scale, and they measured physical activity with a pedometer that the child wore for 7 days, and they found that the vocal tick severity scores and those who were more active were lower, but there was no difference in motor tick scores. Another study looked at behavioral activities associated with onset of symptoms in adults with ticks. And the participants completed a form ranking 3 high-risk activities where ticks were likely to appear, and 3 low-risk activities where ticks were absent or barely present. And this ranking was based on a daily diary, which was kept for 10 days. And 32% of the sample reported that exercise was a low risk activity. So tics were absent or barely present during exercise, and only 2% reported that physical exercise was a high risk activity where tics were more likely to appear. So let's talk about the study that we did at our clinic, which was measuring physical activity, sleep, and neuropsychiatric symptom severity in children with Tourette syndrome. So we conducted this study between 2017 and 2019, and our objective was to examine associations between physical activity, sleep, and symptom severity in children with tic disorders. So we also looked at comorbid symptoms and their relationship to sleep and physical activity. So we looked at the severity of ADHD, obsessive compulsive disorder, anxiety, and depression. So I'll just say, I know I haven't talked about sleep much really at all. I've been just talking about diet and exercise, but just a quick word about sleep and tics. So many studies report a high prevalence, so up to 60% of sleep disturbances in individuals with Tourette syndrome. So they report trouble initiating and maintaining sleep, that there is increased motor activity or movement during sleep, or anxiety or fear while falling asleep. And tics have been observed in all stages of sleep. So we do that through a polysomnogram. So we hook up like the brainwave measurements to the patient, and we can tell what stage of sleep they're in. And it's been shown that even in deep sleep, some patients will still have tics. So to do this study in our clinic, we use something called the Gene Active device, and that's a wrist-worn accelerometer. And this is a waterproof device. It doesn't have to be taken off for swimming or bathing, and it can measure activity and sleep for up to 45 days. And it does this by measuring acceleration, light, and temperature. And it's been extensively used in activity and sleep research in children and adults. So the Gene Active device, for the activity measurements, it measures how much time the patient is not in bed. So it tells you what time they get out of bed and what time they get back into bed, what their wake duration is, any length of time that they've taken the device off. It measures the amount of sedentary activity, the amount of light activity, moderate activity, and vigorous activity. In terms of the sleep measurements, it looks at the going to bed time, the amount of time spent in bed, whether the watch was taken off at all during that time, the total amount of time the person is asleep, the sleep efficiency, which is the sleep time divided by the bed duration, the number of activity periods throughout the night, and the mean duration of those activity periods. So we had people wear the Gene Active device for a period of 7 days continuously. Other data we collected were the age and sex of our participants, if they had comorbid disorders, and the medications they took. We also had people fill out some questionnaires. So in addition to measuring physical activity and sleep using the watch, we also did a questionnaire looking at physical activity, as well as a sleep diary. And we used a rating scale called the Sleep Disturbance Scale for Children, looking at a number of different sleep-related behaviors in children with tics. So we had 110 kids in the clinic with Tourette syndrome or persistent motor tic disorder participate in the study. Almost half had attention deficit hyperactivity disorder. Almost 30% had generalized anxiety disorder. 26% had obsessive compulsive disorder. 8% had major depressive disorder, and 6% had autism. And what we found right from the start was that children with more severe tics reported more sleep disturbances and greater sedentary activity time on questionnaires. So what were our key findings? So we found that there was a direct correlation between tic severity and the amount of sedentary activity time as measured using the GeneActiv device. And there's an inverse correlation between tic severity and the accumulative amount of light, moderate, and vigorous activity time. So the more time the child was sedentary, the higher their tic scores were. And the more time the child was active, the lower the tic scores were. And we found similar correlations between symptom severity and OCD symptoms, anxiety symptoms, and depression symptoms, but not ADHD symptoms. And the strongest associations were actually seen between anxiety symptoms and sedentary activity time. So the more sedentary a child was, the more anxious they were. So we did not find any relationship between measured sleep time on the GeneActiv device and tic severity or severity of ADHD, OCD, anxiety, or depression. We did find that ADHD symptom severity was the most strongly correlated with sleep disturbances on the questionnaire. So the children that had the most severe ADHD symptoms, they had the highest scores on the sleep disturbances questionnaire. So what is the mechanism of action for exercise as a treatment for tics? So we think there could be an acute effect, so an immediate effect of exercise. So for example, people report reduced levels of anxiety and improved mood after as an immediate effect of exercise. It is known that vigorous exercise can increase your serotonin levels, which is a target for anxiety and depressive symptoms. And that body movements that are associated with exercise could replace tics. So it could be distraction, or you can't do the tic because that body part is doing something else, right? There could be also chronic physiological adaptations which occur with physical training. So we know that exercise causes what's called sympathoinhibition and enhanced vagal outflow. So that's regulation of the sympathetic nervous system. The sympathetic nervous system is what kicks in when we have that fight or flight response, right? So when we have sympathetic activation, our body goes into that fight response. And we know that the alpha agonists, so clonidine and guanfacine, these are commonly used medications for tics, and they work on the sympathetic nervous system. So perhaps the effect of exercise is like the alpha agonist by altering sympathetic activation. We also know that exercise lowers dopamine levels. And many of the drugs that we use for tic disorders lower dopamine levels as well. And finally, exercise training improves anxiety. And we know that anxiety exacerbates tics. One of the most common triggers, non-food triggers that people tell me about is anxiety or worry. So is it biologically plausible that exercise could improve tics? I think yes. And I think that because, certainly exercise has been shown to have a positive effect across a wide range of neurological and psychiatric disorders. So this is true for cognitive impairment, depression, anxiety, psychosis, migraine, and ADHD. So just a quick word about diet and exercise and ADHD. So you likely know already that ADHD is very commonly comorbid with Tourette syndrome. About 50% of the kids that we see in our clinic have both diagnoses. And we know that omega-3 supplementation has been associated with improvement in ADHD symptom scores. So it's possible that, in our patients that have both Tourette syndrome and ADHD, omega-3 could be helping symptoms of both disorders. And maybe that's why impairment goes down. There is evidence that exercise programs positively affect physical, mental, and social well-being in youth with ADHD. And both acute and long-term effects of exercise have been reported. And I just wanted to say a quick word about diet and exercise and anxiety. As you know, anxiety disorders are common in individuals with Tourette syndrome. About 30% of the kids that we see in our clinic have generalized anxiety disorder in addition to their Tourette syndrome. And, a big US survey found that regular physical activity was associated with a significant decrease in anxiety disorders. And a recent review of the effect of exercise on anxiety and stress found anxiety symptoms were decreased compared to control conditions. Tic disorders are often worsened in individuals with coexisting anxiety, and interventions for anxiety may indirectly improve tics. So that's something I've noticed clinically, is that some of my patients who are very, very anxious, when we target their anxiety with cognitive behavioral therapy for anxiety, or we treat their anxiety with a selective serotonin reuptake inhibitor, often their tics get better too, even though I haven't directly targeted the tics. So this is my last slide. The current evidence on the effect of diet and physical activity on tics is extremely limited. There is hardly any literature out there. And unfortunately, most of the evidence is of low quality. I think we really need a lot more research to confirm if dietary changes or a physically active lifestyle has a lasting effect on tic severity. But I think there is the studies that we have suggest that exercise has a positive effect on tics.